Hi, my name is Jasmine. I'm a nursing student and I'm going to be demonstrating how to place a patient on a bedpan. You will need a bedpan according to the patient's size, weight, whatnot. So usually bedpans have a shape like this. So this part goes towards their back or their bottom, and then usually they have a spout right here. This toy happens to look like a bedpan. The spout allows you to drain bowel movement, urine, feces into the toilet after you're done. Usually they do have a measurement as well to measure your eye nose. So when you have a patient who is needing to use a bedpan, usually they are incontinent and they will need assistance with going to the restroom. Or they could be immobile or whatnot. So when we have the patient in bed, ideally we want them to be laying flat, or we want them at least at a 30-degree angle to allow us to place the bedpan. We're going to ask the patient to bring their knees up and then lift their bottom up with their hips. This allows us to place the bedpan right under, like this. Okay, we're going to ask them if that's comfortable. If it is, they can go ahead and we can cover them up. They can do their business. They will call us back whenever they're done. When we're done, we clean them up with any wipes if necessary. Then we lay the patient back down at their comfortable position. When we have the bedpan, we measure it if needed. If we need to document the stool consistency, urine, anything like that, we'll do so, and we'll go ahead and empty it. A couple of things to note when you're using a bedpan for a patient or helping them with the restroom: you want to make sure that you are not hurting them. If you're putting like the edge of a bedpan to their bottom, that's causing any like pressure injury. Not that they're going to be on a bedpan for a long time, but you want to minimize those risks. Also, you want to make sure that you're cleaning the patient afterwards. You don't want to leave them dirty. If you need to change any sheets afterwards, do that as well. Also, you want to document how the patient tolerated it, and then your findings as well if necessary. So that is how to use a bedpan.